This audiobook is based on our book about a key philosophical principle in medicine, without which a true understanding of human health is impossible. We extend the previously formulated principle of disease optimality to human health and human life, not only at the individual, but also at the societal level. In this chapter, we are talking about principle of optimality in medicine. Within the WellSpan paradigm, the strategic goal of medicine shifts from aggressive conquest of disease to the art of steering its trajectory. Treatment is understood as the process of guiding the organism toward the least intensive mode of functioning under given adverse conditions. A fundamental error of contemporary medicine is the strategy of normalization at any cost, rooted in a failure to recognize that disease is an evolutionarily refined mechanism of recovery. Instead of supporting this natural pathway, mechanical intervention often disrupts it, attempting to force dynamic indicators to match static standards of health. We regard such forced normalization as misguided. In these cases, the patient's condition deteriorates because the organism's restorative forces must expend resources not only on the disease process itself, but also on correcting the consequences of inappropriate intervention. Optimal treatment should support recovery by creating conditions that preserve systemic integrity and minimize biological debt. The strategic task of the physician is to identify the trajectory that requires the lowest total expenditure of the patient's biological capital. This requires a transition from the protocol-patient relationship to the subject-system relationship. Every medical act, whether prescribing a drug or suggesting a lifestyle change, must be evaluated through the lens of its impact on the system's overall reserves. If the intervention reduces the immediate symptom, but increases the long-term biological debt, for example, through significant side effects, or the suppression of a necessary inflammatory response, its optimality is called into question. The goal is to facilitate the organism's natural transition back to its healthy corridor, providing only the support necessary to prevent the system from falling into a destructive reoptimization loop. Physiological value of symptoms and criteria of optimization. Drawing on the role of symptoms as navigational markers of deviation from the optimum, we use them in clinical practice to assess the adequacy of interventions. Symptom dynamics is the primary criterion for determining where the disease is heading and whether the chosen actions constitute a sound investment of resources. If, under therapy, symptoms change in such a way that the system returns toward a coherent state while energetic expenditures decline, the intervention is considered optimizing. Genuine diagnosis in WellSpan medicine consists in determining whether our intervention helps the patient find the shortest path to recovery, or whether it becomes an additional allostatic load. Symptoms indicate whether the organism still possesses sufficient biological capital to pay for the necessary adaptation, which is crucial for correcting the entire strategy of patient management. The effectiveness of any therapeutic maneuver depends on understanding individual tolerance and the system's capacity for compensation. The dosage of intervention must be strictly proportional to the available health reserves. If treatment is too aggressive, it becomes an additional source of load, turning into biological debt. Conversely, insufficient intervention creates a trap of biological stagnation. The system does not receive the impulse needed to overcome the activation barrier of disease and continues to expend resources on ineffective adaptation. This leads to chronicity, in which the organism spends its biological credit not on resolving the crisis, but on maintaining an exhausting equilibrium with the stressor. Optimal dosing always seeks the point at which the impact is strong enough to initiate directed recovery, but does not cross the threshold of the organism's current endurance. The core principle of optimal medicine defines intervention as temporary outsourcing of regulation. Drugs and technologies can substitute for exhausted links in internal control circuits, but they must never permanently disable the biological system's own feedback loops. The boundary of intervention lies where external assistance begins to hinder self-repair. Pharmacotherapy should operate according to the principle of minimally sufficient influence. If treatment completely shuts down feedback, for example, through uncontrolled use of replacement therapy where an organ still retains functional capacity, we risk atrophying the organism's own control system. True clinical mastery lies in exiting the regulatory process at the right time and returning the trajectory control to the organism itself. Once internal resources are sufficient to sustain autonomous coherence, intervention must be withdrawn, giving way to the organism's natural forces, the only guarantors of term WellSpan. We will be grateful for your likes and for sharing information about this audiobook with others.